question, is it possible for children to get depression? Well, today we're going to have a short talk on depression in younger populations. I'm Aladin Kemi, a resident in the Department of Psychiatry at College Teaching Hospital. The age groups we're going to be looking at are from infancy to age 19 years of age. And we're looking at the childhood and adolescent phase of life because it's a complex phase which is fraught with a lot of peculiarities that make people within this age group vulnerable to mental health challenges. This topic is quite relevant in Ghana because it's estimated that 22% of the Ghanaian population fall under the age of 18 years. Globally, about 14% of people within the ages of 10 to 19 years of age are at risk of developing mental health conditions. The common ones are anxiety disorders, behavioral disorders, as well as depression. I'd like to point out that these conditions might not present with the classical symptoms that are observed in adult populations. Case in point is depression, which presents with pervasive and persistent sadness, or what is described as a low mood, anhedonia, which refers to loss of interest in things they like doing, as well as reduced or low energy levels. However, in younger populations, the presentations will vary with the age groups. So you could see low mood, you could see anhedonia, but symptoms like irritability, boredom, throwing temper tantrums, lability of mood, presence of somatic symptoms, as well as social withdrawal are noted. Changes in sleep and appetite are less likely, and the presence of delusions and hallucinations are quite rare. Now, it's estimated that 2% of prepubertal patients will present with depression, and this number increases to about 4 to 8% of adolescents presenting with depression. Relapse is common as well as recurrence, and this contributes to significant morbidity and mortality. It's estimated that 2% of prepubertal patients will present with depression, and this number increases to about 4 to 8% in adolescent age groups. Relapse and recurrence are quite common and are associated with significant morbidity and mortality. Depression can affect a child in several ways. It can affect the child's quality of life, their academic achievements, can put them at risk of developing long-standing impairments, and can also increase their risk of substance use as well as suicide attempts. It's quite common in girls. The ratio of male to female is about 3:1, and early onset of puberty in females is a notable risk factor. Other risk factors that have been identified are grouped into genetic, environmental, as well as psychological factors, and these include a family history of parental depression, particularly chronic parental depression, predisposing one to developing depression, presence of parental substance use, bereavement in the family, family discord, as well as parental criminality are notable environmental factors. Other mental health conditions like anxiety disorders, behavioral disorders, conduct disorders, and intellectual disorders are also noticed to increase the risk of developing depression. Now, for diagnosing depression, there is no gold standard laboratory investigation. So to evaluate such patients, psychometric tools are employed. One of them is the Childhood Depression Rating Scale, which is a 17-item instrument. And this scale is usually functional in patients within the ages of 6 to 12 years. We also use the patient health questionnaire, and fortunately, this scale can be used in all age groups to evaluate patients' depression. Patients with major depression are at a risk of developing bipolar affective disorder in about 30% of cases. Looking at treatment involves both psychological and pharmacological methods. For mild cases, the use of only psychological methods are encouraged, that is, using psychoeducation as well as supportive interventions. While moderate to severe cases, you want to combine both pharmacotherapy as well as psychotherapy. So for psychotherapy, you introduce the use of cognitive behavioral therapy or you use interpersonal therapy. While for pharmacotherapy, most of the medications used fall within the class of drugs known as the SSRIs. Now, another treatment modality that has been noticed to be safe and efficacious, although rarely used, is ECT, which is electroconvulsive therapy, particularly in adolescent age groups. So I'd like to point out that combination therapy is the most effective treatment option. To conclude, depression is not only seen in adults, it
it is present in younger populations, it's present in children, present in adolescents. And although the presentation might vary, early recognition, treatment has been noticed to improve the outcomes and prevent long-standing complications. Thank you very much.